I want to thank you for joining us this morning. We're here to announce the launch of the Indoor Environmental Testing Plan in the homes in Porter Ranch. And the purpose of this press event is to keep the residents of Los Angeles County informed about the work that we're doing, as well as give you all an opportunity to ask questions. We're going to begin with remarks from Catherine Barger, who is the Chief Deputy for Los Angeles County Supervisor Michael Antonovich. And we'll follow that with some remarks from R. Rex Paris, an attorney representing some of the homeowners for the area. And then our interim health officer, Dr. Jeffrey Gunzenhauser, will make some remarks, as well as Angelo Bellomo, who is the Deputy Director for Health Protection for our department. Once they've given their remarks, we'll begin to take some questions. And now I'd like to invite Ms. Barger to the podium.
Thank you, Cynthia. Good morning. It's really unfortunate that we had to even have to go into court to get the gas company to do what was right. But I'm pleased to announce that the appellate court has granted us a TRO, and next week we will be fighting to extend the period of time the gas company has to pay for residents to remain in hotels or in homes pending a completion of review of their homes. Why are we doing this? The residents have a right to know that when they return home, they're returning to a home that is safe and free of any dangerous carcinogenics that may impact their health. Public health has taken time and reviewed all the necessary protocols to ensure that when we go in and do this test, that we can give the assurance necessary for these people to return home and not be in fear of getting sick. I want to thank public health, and I want to thank Angelo and Cynthia for their hard work moving forward. People have wanted us to move quickly, but this is not something that you can just move quickly on. We have to provide sound scientific proof that what we're doing is necessary. So on that, I would like to also introduce R. Rex Paris, who's representing a majority of the Porter Ranch homeowners who have the greatest impact as it relates to this issue. So Rex.
Good morning. Let's be clear about what we're talking about. UCLA, one of the finest universities in the world, has tested some of the homes and found toxic substances that can ultimately cause cancer in the hardworking families that live in those homes. How is it possible that the gas company would even allow people to go back, let alone say they have to go back? What the gas company should be doing is behaving responsibly and have some accountability for what they've done and clean those homes and make absolutely certain that those children are safe. How hard is that to understand? And the fact that they're not is deplorable. Thank you.
Good morning. My name is Dr. Jeffrey Gunzenhauser. I'm the Interim Health Officer for Los Angeles County and work here in the Department of Public Health. First, I want to extend my strongest thanks to Supervisor Antonovich, to Catherine Barger, and to the other members of the 5th District Office who during this period have provided extraordinary support and leadership in supporting the interests of health protection to the residents who are living in the Porter Ranch community. First, I'd like to emphasize, just so everybody is aware, this is the largest environmental methane release in the history of the United States. And as a result, it has caused a very serious nuisance for the residents of Porter Ranch, and that this nuisance and all of its effects, which have been created by the Southern California Gas Company, must be abated. To the residents of the Porter Ranch community, which have been so impacted by this release, I want you to know that we in the Department of Public Health have and are continuing to hear your concerns. We know that many of you have been out of your homes for months, and that many of you are continuing to experience symptoms. As you all know, the Department of Public Health is a science-based organization. And what we mean by that is we collect all information relating to health, including self-reports from residents who may be continuing to experience symptoms, and looking at all indoor and outdoor environmental testing that may relate to the symptoms that have been reported. Even though the well has been sealed for more than a month, we are continuing to receive complaints from many residents who've remained in their homes or who have recently moved back into their homes in the Porter Ranch community, and they're complaining that they're still experiencing symptoms. Our focus in the Department of Public Health right now is to better understand the nature of these symptoms and to do additional testing to determine what the cause may be. To learn more about the health symptoms that people are experiencing and factors that may be contributing to these, this month the Department of Public Health has completed a door-to-door health survey of 210 homes, which are located within a 3-mile radius of the previously leaking gas well. In this regard, we want to express our appreciation to the California Department of Public Health for their support in allowing us to complete this survey. We're just analyzing the results now, and any findings that I can share with you are preliminary in nature. A key finding indicates that about 60% of people surveyed are still experiencing symptoms that are similar to those which occurred before the well was sealed. We expect to release the final report on this survey next Monday, March 28th. Professor Jarrett of UCLA recently conducted an independent study in 7 homes in the Porter Ranch area. Public Health is working with UCLA to evaluate the data to determine if his findings are related to the Aliso Canyon natural gas leak. At this time, from my point of view, the data are limited and insufficient to draw any conclusions or make decisions, and we need more time to complete additional testing and to analyze the results of that testing. Public Health will be in the field later this week to begin indoor environmental testing, and we're conferring with Professor Jarrett and the U.S. Environmental Protection Agency for assurance measures. This testing will provide comprehensive, useful data about the potential exposures contributing to these continued symptoms. Mr. Bellomo will provide more information on these activities. I want to assure you and the community that if any time Public Health observes any unusual findings in assessment data, we'll notify the community who may be affected and take any actions necessary to protect health. This concludes my update, and I'll now be followed by Mr. Angelo Bellomo, who's the Department of Public Health's Deputy Director for Health Protection. Thank you.
Thank you very much. I think as Dr. Gunzenhauser just mentioned, we're working very closely and have been with UCLA, Department of Environmental Health Sciences, and with U.S. Environmental Protection Agency on the development of the work plan that we're going to be discussing with you. The work plan has also received review and input from the State Department of Public Health because they also have expertise in this area. So we've really brought to bear on the development of this work plan the expertise needed for this type of unique and unprecedented situation. The testing will begin on Friday, and it will take place over a period of what we estimate may be 10 days of testing in the field. The testing will be implemented in 2 phases that are back-to-back. The first phase will begin Friday. The second phase will begin on Tuesday. There's a broad range of chemicals that we're looking for in this round of testing. I think many of you know that in the initial testing that's been done out at the site, tests were done in the air for a comprehensive list of the obvious chemicals that are associated with the release of natural gas from a failed well. And that data is still being generated today, several weeks after the well was capped. The broad range of chemicals we're focusing on now will include volatile organic chemicals, what we refer to also as semi-volatile organic chemicals, metals, fine particulate matter, and we'll be looking initially in 100 homes that are within our target area, the areas where the highest frequency of complaints have been received, and where the levels have been highest in the community. We're also going to be identifying a control group. When you sample as many as 200 individual chemical compounds, which this testing will be looking for, and it's going to be looking for it in the gaseous phase and the particle phase as well. When you sample that large number of chemicals, not all of them are exclusively associated with oil field operations. So for those that may not be exclusively associated with the oil field, we have to have background data. When you park a car in a garage, for example, and it's an attached garage, you could have some of the fuel components from the gasoline entering the home, and you can pick those up. So the control group will help us determine what is in a typical house that is similar to the homes in Porter Ranch, but not subject to the influence of the gas field or the release. That's the purpose of the control group. So we'll be looking at 100 homes within the target area in the community and approximately 10 homes that are going to be serving as a control group so that we have good data as to what these chemical concentrations may be in a typical home, but again, not influenced by the Aliso release. We will have 13 two-person teams involved in the testing, and we'll have a large number of support staff in the field that are supporting those field teams. The field teams will go in and during the first phase will probably spend an hour in the home. The first phase, which begins on Friday, will consist of what we're calling surface wipe sampling, where filter paper will be used to do a wipe of surfaces in the home, and also contact tape, biotape, that will pick up particulate in the home. This part of the sampling program this portion of the sampling program will be led by Dr. Jarrett and his investigative team, along with the participation of the county public health department and our consultant. What we should be looking at in the way of timing is that phase 1 should be completed by the weekend. That's how quickly that will be done. We hope to get most of it done on Friday. If we have to come back for maybe 10 to 20% of the remaining homes that we're testing for phase 1, it will take place either on Saturday or on Monday. Phase 2 will begin on Tuesday, and it's the gaseous sampling, and that will persist, or the air sampling, that will persist probably over the course of 8 to 10 days. So within 10 days, starting Friday, we should be complete collecting all of the data, the samples from the field. They will go to the laboratory. We will start to get samples back within 3 days. Not all of the sampling will come back within that time frame. Some of it's a little bit more sophisticated sampling, could take as long as 2 weeks to get that back. And then we'll probably spend several days to a week interpreting all of the data once it's back from the laboratory, and we'll have more information at that time. At this point, what I'd like to do is just open it up to questions and answers, and those of us that are here will be happy to indulge you in the questions. They are within the Northridge area, but not impacted by the release at Aliso. I don't have the exact location for you, but they are control group homes which will not have been impacted by Aliso release. Well, the one that I think is of most interest was benzene, and Dr. Jarrett did share those results with us. I think as Dr. Gunzenhauser mentioned, we're always interested when these chemicals are found, but the information so far from the round of sampling that Dr. Jarrett and his team did is still very preliminary. Dr. Jarrett and us are in agreement on that point, and what it really does is it calls for further sampling. The reason why it's difficult to characterize the levels that Dr. Jarrett collected is they were surface wipes. And in essence, what happens is filter paper is wiped over a certain number of square centimeters. And when you get the result back, you're getting basically the amount of benzene per square centimeter, and we don't really have standards in the country that apply to benzene. There was a lot of work done following 9/11 on surface wipes inside structures, but benzene wasn't one of them. I think we've got some other commenters here as well.
Just in case there's any questions
Okay.
as it relates to the homeowners.
Excuse me, let me check. Remember with the benzene that they're seeing it tied to particulate matter? That particulate matter will embed in the lungs of the people breathing it, and it will not come out. That means we have children in those homes, if it's widespread, that are breathing this particulate matter and will spend the rest of their life with a cancer-causing substance embedded in their lung. The seriousness of this, the catastrophic nature of this cannot be overstressed. Until they know that each and every one of those homes is clean, those people are at risk. Every one of us know what needs to be done. They just need to do it.
What exactly do they need to do?
They need to go in there and, one, make certain every single home is free of those toxic chemicals. The homes that are not free of them, that are testing positive, need to be clean. And the Mary Maids are not capable of cleaning them. This is a very sophisticated operation that has to take place, and then they have to be tested again to make certain that not one child is putting benzene into their lungs. It's a simple analysis. It's a difficult process. And yes, it's going to cost a lot of money. But when you make a mess, you have to clean it up. Every one of us know that.
So is this something like that when you still going into cleaning up asbestos? People are familiar with how that process works. So you liken it to that?
I think it's harder. I think it's harder because of you don't know where to look. You got to look everywhere, and it's widespread. Remember what happened on that blowout. You not only have these volatile toxic chemicals coming out under great pressure. Many, many occasions, they stuck thousands and thousands of pounds of cement down that hole. All that cement came out into the air and went into those homes. It's a much more complex problem than just methane gas. And they keep wanting to focus, the gas company keeps wanting to focus just on the methane. And thank God for public health, because I think that's where the analysis would have stopped.
And so since you're saying that you're finding benzene on what sounds like just a simple process by a light to an untrained person such as myself, it sounds like this is pretty widespread. We just don't know how widespread it is. If you're finding this with just wiping on tables, curtains, wherever you are wiping.
Well, it has to be, but Angelo's the expert. I'm just the lawyer.
Right. Let me just, I want to go back to something that Dr. Gunzenhauser reminded us of, which is we employ scientific methods, and we're looking purely at evidence when we decide what needs to be done. So the truth is this: we break this into two phases. The first phase is trying to characterize the nature of the presence of these chemicals and the risk that they present by their presence. The second phase is to determine whether or not there's the need for remedial action, and if so, what is that action that needs to be taken? And that is a phase that we are launching on a parallel path with our partners that we discussed earlier. We will be looking at what may be needed in the way of a cleaning protocol. For example, if we had particulate matter at concentrations, and I'm talking about particulate matter that has other chemicals absorbed to it, like has been referenced. But the first phase is determining what is not only the presence of the chemical there, what's its concentration, and what is the hazard that it presents.
Like I'm saying, if I'm a homeowner there and I hear you guys are finding this stuff just by wiping the surface, I'm worried. What do you say to that?
Well, again, if you just think about the fact that benzene is commonly found throughout the urban environment. If we were to sample air where we're standing and breathing right now, we might find benzene at a part per billion. Information is still too preliminary, and we can't even compare that number that was found to a standard because there are no standards. So this is information we're putting together. I just would caution everybody, let's be concerned about the presence of chemicals that we're finding, but let's also collect the information necessary to determine what specific risk or hazard that presents. Thank you.
And I would just like to add that, from the standpoint of the county, that is why we have gone into court, is because we have enough of a concern based on the initial findings that we want to provide adequate time. So yes, we are worried. We want to make sure that the residents are protected, and going into court to extend the period of time allowed for residents to stay out of their homes will give us that opportunity to go in and truly do a test that we're confident will clear the homes or allow us to clean them up. As our rec said, it's going to take, if necessary, a highly specialized cleanup crew, and we want to give the residents that assurance. So the county is going to go into court and fight this.
Where are the residents of the 100 houses where you keep them? Are they back home? Are they hotels? Do you know where they are?
Some of them have relocated back into their homes and others have not. We're not limiting the testing. Let me just tell a little bit about the selection for the homes that will be tested, the 100. We are focusing on those areas where we've had the highest number of complaints, relocations, health complaints, relocations, and where the highest readings of outdoor air quality existed. So we're talking about homes that are either close to the release site or downwind of the release site. We would prefer to go into homes that are unoccupied, but we won't limit it to just unoccupied homes. We will likely be looking at both unoccupied and occupied homes.
Is DWP going to be, or the gas company, are they helping you with, what's their reaction to your saying, hey, we got to go and test 100 homes, and this is a big deal? I mean, have they said anything to you, or you have to force the issue?
I think you should check with them on that. The gas company, we will be asking them for a number of things, access to information they already have, and we're hopeful that they're going to be providing that to us, but we'll see.
Wait a minute, let's not sugarcoat this. The gas company has resisted every single attempt to protect those families. Unequivocally, they have resisted every single attempt. Everything they've done that we can see from the lawyers representing the homeowners has been cosmetic. They have yet to meet with us and try to figure out a way to protect these people, nor do we expect them to do so. If it was my children, no way would I return to those houses.
Let's keep in mind a couple of things. We have a number of people, many people, who have never left their homes and are still in their homes. For those that did leave, and when they attempted to return, their symptoms reoccurred, the advice we gave them was continue to stay away. But this is a difficult situation because we don't have the information as rapidly as we would like to be able to make global statements right now. So we're trying to be very thoughtful about this. We are very concerned, as Catherine Barger had said, we're very concerned about the potential for contaminants in the homes, but we are not recommending that anybody leave their home unless they're exhibiting symptoms. Now, I think that, there's a wide range of opinions there, but I just want to clarify, we have not seen data in outdoor air or in indoor environment yet that would cause us to say people should be leaving their homes. I want to be clear also that this public health department would not hesitate the moment we see information that would suggest to us there is a hazard, we would act very quickly to do what was necessary to mitigate it. Yeah, good, very good question. The question was, what is our theory about what is causing the symptoms? And I'll let Dr. Gunzenhauser join me on this, but I would start by saying this. Originally, by the way, we do not believe that benzene in itself would present these type of short-term symptoms at the concentrations they likely exist in the home. However, Now that we know that there may be particulate matter in the homes, that particulate matter, pending further analysis on the nature and what it's actually consisting of, could help explain why the outdoor levels of the gases that have been monitoring have all basically mitigated to near background levels, but we still have continuing symptoms. It may be chemicals that are associated with the oil field that may have undergone some transformation as it came out of the well in the atmosphere, or may in fact have carried out other chemicals from the reservoir, the depleted oil reservoir. And these are all theories that we're discussing with Dr. Jarrett and our colleagues at US EPA, and we'll be talking more about those as we're able to learn more on those.
Yeah, I'd like to add a little bit to what Angelo is saying. The first thing I do want to point out again is that folks are experiencing symptoms. This is a major nuisance, and we're trying to get to the bottom of this. From my point of view, in reviewing the evidence of the preliminary testing that's come from UCLA, it's very preliminary. It is very preliminary. It's not the kind of information that I feel is near where we could make a decision or advise residents in the community that this is a wide-scale problem. However, it is suggestive, so we do want to do further testing, and we need more time to do that. The new theory that has been posed that, we have been asking many experts in this area for advice along the way. We've tested for everything that we've known of. We've published those reports. We've looked at benzene, the volatile organic compounds, and a host of other things in the air other than mercaptans, the odorants in natural gas, to see if those have been elevated, and they haven't been elevated in a range that's been of health concern. So that's been reassuring to me as the health officer, providing some confidence that things that we would be concerned about, we haven't found that. So this new information is preliminary. So I would discourage folks from making the association that the symptoms that people are experiencing are related to benzene or anything that could be carcinogenic at this point. That's not the scientific conclusion that I draw from this, but my conclusion that it is concerning. It points us in a new path. It could lead to understanding this better, and so we're aggressively pursuing that additional testing as soon as possible so we can determine that.
Okay, we'll take one more question, and then we're going to end.
Why does it have to be highly specialized?
Well, we can't really comment on the benzene because, again, Dr. Jarrett and us really can't make conclusions. We don't have any actionable information yet on this preliminary information. But I think what you were saying is, why couldn't conventional cleaning methods work? Conventional cleaning methods may work, but until we know the character of the chemicals that we're attempting to clean up, do we have dust? And by the way, we are looking at house dust as well, and what could be within the house dust that are of oil field origin. And so we're looking at that as well. We have to first know what's there. We may need, what typical cleaning solutions may work if there's a need to clean the interior. Airing out the home may work for some of this as well, but we may have some persistent chemicals that are carbonaceous in character that may require other solvents other than water and soap to remove. So again, we're kind of venturing out there just to try to keep the dialogue open here, but we don't have enough information to answer what would be an appropriate cleaning method if it's necessary.
Let me add to that a little bit. If you have a toxic dust on your coffee table, you also have it in your ventilation system. If it's in your ventilation system, Mary Maids is not going to clean that. It is much more involved than dusting the coffee table off.
So I want to thank you for joining us today. If you have any follow-up media requests, please send them to media@publichealth or ph.lacounty.gov. Thank you very much.